this platform. So we've been using, there we go. So we're alive now. So,
Great.
hey guys, I'm Nate, physical therapist with Fit Muscle and Joint Clinic. And I'm excited to bring you guys the first in a series of interviews with physicians and medical professionals in the Kansas City area. Today we're going to chat with Laurel Short. She's a nurse practitioner with KC Bone and Joint Clinic in Overland Park. She completed her doctorate at the University of Missouri in Kansas, and she emphasized in self-management for chronic migraines, has a headache specialist certification through the National Headache Foundation. Her clinical practice includes comprehensive musculoskeletal and neurological rehabilitation medicine. So, Laurel, thank you for joining us today. Sorry for the technical difficulties. Why don't you just open us off with a little bit of kind of a personal backstory of you, like where are you from originally, and then just a little bit about your practice and what does PM&R medicine mean for you?
Sure. So I've been a nurse since 2002, and I was born in Tennessee, but mostly raised in the Kansas City area. I went to a small liberal arts college for my undergraduate and then came back and worked at Children's Mercy. When I was getting my family nurse practitioner degree, that's when I kind of discovered the area of physiatry or physical medicine and rehab. I had literally never heard of the specialty, but was introduced to a physiatrist and just really identified with the philosophies and decided I wanted to go into it. So I've been working in physical medicine and rehab since I finished my master's degree in 2010. So 10 years this summer, which is very exciting.
Wow, congratulations on that. It's this
Thanks.
summer.
Yep. So 10-year anniversary. And then I decided to go back and get my doctorate with UMKC, as you mentioned. So I finished that a year ago.
Fantastic. Yeah, I remember when you had come and spoken to our group previously, you said that it sounded like that was pretty recently completed. So I didn't remember.
Mm-hmm.
That was actually just last year. So why this area of specialty? How did your coursework and your kind of personal and professional background bring you to this place?
Yeah. When you're a nurse practitioner, the degree you get is usually as a family nurse practitioner or an adult nurse practitioner. There are some specialties that you can subspecialize while you're in school, but most of us kind of specialize after school and do continuing education in our field of specialty. And that's what I've done with physical medicine, and then with kind of even the more subspecialty of headache and migraine within that. So it's a lot of extra kind of on the job learning, going to conferences, continuing education. But what I really like about physical medicine is that it's very functional, right? So whatever the person's issue is, whether that's back pain or a neck injury or migraine headache or even a spinal cord injury, it's always about what are the functional goals and how can we get you kind of back in the driver's seat, and feeling like you're in control of your situation. So I really identified with that. And even in my undergraduate studies, I really liked looking at self-management and the concept of self-management. How do we empower patients and individuals to feel like they can be in control of their situation and do things in, I love now that we have this term multimodal, so what can I health behaviors to help manage a chronic condition, whether that's asthma or diabetes, or now what I really have enjoyed focusing on is migraine headache. So I guess that's kind of a common theme throughout my career as a nurse and now an advanced practice nurse, is helping patients with self-management.
Yeah, and that can be, you covered a broad scope of topics and areas you work with there, but specifically for the migraine and headache patient or someone who suffers with those things, at least in my experience, it's one of those things where you often feel like your control and your ability to kind of take care of yourself or handle your own day or your own workload is just completely out of your hands. So, a lot of people that may be watching this maybe suffer with those symptoms or deal with that on a daily basis. Maybe they have had some care with that in the past or they have not. So just can you speak with a little regards to at what point you recommend individuals can receive treatment for that, or they should, and just kind of briefly some options out there for them?
Yeah. When it comes to migraine, honestly, the sooner that you can get with a headache specialist, the better. We don't want to wait until someone is having a headache every single day. Fortunately, we do have more awareness about what a migraine is and that there are treatments out there, but there is still an underdiagnosis going on. So as a perfect example, I saw a patient just the other day who has been diagnosed for about a year now with migraine, but before that, he'd had symptoms for 10 years. And that's very common. Patients think they're having sinus problems, or they just say, I'm having bad headaches, and they don't realize it's a migraine for many years. And again, we don't want to wait until someone is completely out of control and in a situation where they come into that first visit. And this will happen where patients will say, I just don't even know where to start. I feel so out of control and so overwhelmed with my symptoms. So to kind of break it into two simple categories, when it comes to migraine, we talk about episodic migraine, and that's where someone can be feeling great. They're just going along, living their life, and maybe once a month or a couple times a month, they'll have a migraine attack or a migraine episode. And then when that attack is over, they're back to feeling good again. The other category that we talk about is chronic migraine, and that's when someone at least half the month, so at least 15 days a month, they're having a headache of some sort. That doesn't mean they're laying in a dark room all the time, but it means at least half of every month, half of every week, they're being affected by these symptoms. We don't want to wait until someone progresses from episodic to chronic. We want to help keep them in that episodic category, knowing that it may or may not go away completely. And that's part of what we do with patients, is help them understand this is something that you'll continue to deal with, but we want to give you tools so that when you have those migraine attacks, you have medicines, you have strategies that help you deal with that.
I'm going to segue off of that a little bit. At what point do you, so let's say someone is consulted, they maybe already have medication, or they take a rescue medication. At what point do you consider adding like rehab or physical therapy in there as to that treatment plan for that individual?
That's a fantastic question. And with all the patients who come into the clinic, I will use the term toolkit approach. So it doesn't matter if they're having one migraine a month or 10 migraines a month. We want to look at a combination of both medications and things that aren't medications, because there's a lot that we can do with our everyday lifestyle health behaviors to help manage migraines. And in your question specifically about therapy, whether that's physical therapy, massage therapy, we know that the data shows us that over 70% of people who get migraine have associated neck pain and neck tension with it. It's very, very common. And so I would say majority of our patients, I recommend to work with physical therapy or exercise techniques through yoga, core exercise, things like that. So we have science and data that shows us that exercise and physical therapy is beneficial for migraine. And it's also my personal opinion as a clinician that working on both strengthening, stretching, posture awareness, all of those things are extremely beneficial for people who have headaches and migraine.
Yeah, so that's great to hear from your end too, because it's been, before we kind of started working and consulting with you and kind of learning from your expertise, that's been something that I had seen, clinically, just on my own end, even, not the pharmacological management side or things like that. But I just always wondered the correlation, because then there were still kind of those outlier groups that hadn't sought formal consultation from someone with your expertise and kind of area of approach toward managing those symptoms. And they seem to get good relief, but there's always something that seemed to be missing, or even vice versa. Patients who had only done the side, but not considered, the strengthening, the physical activity, the physical to it. So speaking of to like strengthening and things like, you were training for a triathlon, right? Are you still training for one?
Yes, I am still staying active, still doing as much as I can. The triathlon was officially canceled last week, which was somewhat of a relief, because obviously the pools have been closed for a couple of months now. So yeah, it was going to be my first half Ironman distance in Des Moines, Iowa in June. And I chose the deferral to next year as the option, because I'm not very confident that it will be safe to have races even this fall. So I would rather wait until next year when things can kind of hopefully be back to some version of normal when it comes to racing. But there's still a lot that we can do to stay active, and it's extremely important for our mental health right now, I think, for all of us to be staying active.
Yeah, yeah, absolutely. Is there, so postpone that till next year. Is there anything you're still trying to aim for, or even just personally and from a training benchmark on your end that you're just trying to motivate yourself, or do something like a personal PR for Laurel or whatever you might be shooting for throughout the rest of this year?
Yeah, I'm really involved in an online women's running community, so I think that helps. And I have still been meeting with, either one friend or just a couple of friends, and running in a socially distanced fashion. So still running a few days a week and trying to include some cycling in there. And something I've enjoyed during this time is leading some strength workouts on my driveway with a couple neighbors. So we've been doing that twice a week, get together for about 45 minutes. And so that's been really fun because neither of them were exercising on a very regular basis. So it makes me feel good that I've helped motivate them to do some exercise.
That's awesome. Yeah, way to be a motivator still, even with everything going on.
Yeah.
Around do look different. For a lot of people, use that kind of formal, they're just like throw it all out, and it's like, no, you gotta do still something, and it's way better for you. The specific question, well, two-part question. So for the patient who does suffer from like flare-ups or flare-ups and symptoms from their migraines, chronic headaches, and things like that, when they do start to try to increase physical activity or maybe seek formal physical therapy treatment sessions, you try to encourage them either on the front end to anticipate those flare-ups and symptoms, or to kind of encourage them to stick. We know that they are so much better in the end if they do incorporate that.
Yeah, I think that's a great point. And as you probably would agree, not everybody has those flare-ups when they start physical therapy or start a new program, but I've definitely seen that as well. And just as a recent example, I have a female patient who was under good control. We have an injection treatment that she gets every 12 weeks, and she had some rescue medication. But she was unfortunately in a small car accident when she was rear-ended, and so that kind of flared up her neck pain quite a bit. And I thought that, get her in some physical therapy and that would really take care of it. And actually she was having some increased symptoms after the physical therapy sessions. And we weren't able to figure out exactly why, but just to point out that can happen. And in general, I try to prep patients for that, just like I would if you're starting for chronic back pain or chronic neck pain, that those muscles have kind of gotten in these habits of staying tight in certain ways. And so as we're trying to retrain them and break those habits, sometimes there can be a short-term increase in symptoms or a shifting of symptoms. And let's just try to stick with it usually they can get over the hump in a few weeks. And if we include other strategies with the therapy or the exercise, then hopefully we can mitigate or kind of minimize any of those side effects. So sometimes I'll use athletic analogies with patients. So, if your goal is to do a marathon, you're not going to just do that out of the gate, right? You're going to slowly train and make yourself stronger. So I'll try to, kind of frame it in that way. And again, talking about, well, what else can we do? So a phrase that I use with patients a lot is, let's control what we can control. Can we look at your sleep schedule? Can we look at your hydration? Can we look at some nutrition? And I really recommend to all my patients to keep a headache diary or some sort of way that works for them to track their symptoms. That way, visually over the course of a month or two, we can slowly see those improvements, and that gives the positive feedback to them that, hey, a month ago I was feeling this way by 3 o'clock every day, and now I'm not having those spikes that I was having.
Yeah, I love the idea of like a headache journal. That's something that I try to encourage my patients to do as well. They're dealing with those symptoms. I mean, anything, low back pain or whatever, because it's a weird dichotomy that seems to happen. But it's like you make meaningful progress, and it's actually pretty significant, especially maybe from our end as a clinician. but they're still their present mindset is on the symptoms that are still lingering and still there. So it's like, from an encouraging standpoint of like, no, you told me last week you had 3 migraines, and this week you've had 1,
Right.
or you're sleeping now, through the night without your back killing you, or something like that. So I think that that's huge. And that's another thing, like you said, that's just super empowering for the individual themselves, because they're seeking the care, they're getting outside help, but then they're seeing the things that they're doing themselves, that they're choosing voluntarily on their own, that is making a significant impact and making their life better, which is huge. So
Absolutely. And I'll have patients that'll just have these kind of aha moments of, oh, I cut back on my caffeine, and within 2 weeks, I didn't have to give it up, but maybe just cutting back and the headaches are better. Or I'm really bumping up my water intake, or I'm having protein with my breakfast. And one tip for anybody who's listening that gets headache or migraine, instead of trying to do a detailed number scale, I just have my patients do a color system of green, yellow, red. So green is a mild day, yellow is medium, and red is a really bad day. And that way, again, visually over time, it helps kind of see how you're doing. And I'll have patients come back and say, hey, I had mostly green days last month, or I had days where I didn't even have to put a color down because I didn't have any headache for 5 days in a row.
yeah. Yeah, and it's almost like that visual reward, like positive feedback too. Like it's internalizing that motivation for them. Like, yes, what I'm doing is working. Like I have control over this. So, kind of a nerd question. So what? Just it could be anything. Just throw something out there for you, and then I'm gonna ask another question on top of that.
Okay, you kind of it froze for a second. I think the question was, is there something I nerd out about? Was that correct?
Yeah, so you're just like, you have, an extra 45 minutes in your day. You're just like, okay, what am I going to do? What am I going to YouTube? What am I going to Google search, whatever? Just what makes you happy to
Yeah.
just geek out about?
Well, on the theme of my endurance training and running, I really enjoy kind of geeking out on the whole process of that. So looking at my training plan, I really enjoy planning the long run routes for the weekend. So when I trained for the marathon in Kansas City last fall, I had a friend that I would meet up with every Saturday, and I just really enjoyed kind of planning our route out, getting ready for the whole thing. Kind of just tracking the progress. I'm not as much on the data about how fast I went or anything like that. It's just all the other that go into the training. So yeah.
Okay. And then, so in all of your extensive, have an opinion or information on if you think the weather affects people's migraine symptoms? Like, case in point, the crummy weather we're getting right now in KC. Do you think that
Yeah,
changes in barometric pressure, things like that, affect migraine symptoms? And why do you think that they do,
I
if they
do.
do?
I personally do. We don't have an exact scientific reason for that, but we do know people with migraine have what I call just sensitive systems, right? So even on a day where they're feeling good, the bright sunlight may seem brighter to them, or a loud movie theater may seem louder. They're just, the way they are wired is they're more sensitive to any external input. And that includes things like the barometric changes. And certainly many of the patients I work with, both in the spring and the fall, but especially the springtime, will say that their migraines are worse. And there may be some seasonal allergy component to that as well. But something about that barometric pressure coming up and down can absolutely trigger a migraine. And unfortunately, we can't always control the weather. So that's when we get back to, hey, if we know this is a rough season for you, what else can we be really diligent about and trying to help control? So, yeah.
Beautiful. Yeah, I love, again, bringing that back to what do we have in our control? What things can you do? What are the positives we can focus on, and not just the can't do's or the limitations? So final question. Again, just another kind of personal fun question to end on a high note, kind of a fun light note. But what's like your guilty pleasure that you jam out to, either during your training or when you're nerding out about something online or anything like that? because you know people want to know about that. And it could be anything. It's guilt-free zone here.
Guilty pleasure music, was that the question?
Yeah, just like a song or an artist or a genre you just like jam out to unashamedly.
Oh, definitely like pop all the way. Just, a good Taylor Swift or anything that I can sing to. And yeah. And I have little kids, so same goes for having a dance party in the kitchen. Something that we can all sing to and has a good beat to it.
Do they encourage you
With my singing, depends on their mood. Sometimes, I get especially in the car, I'll get from the back seat where, stop, Mom, I can't hear the song. You're singing too loud. Sometimes they let me go for it. And I don't know if
you just go free range.
Right. I don't know if you've seen the Trex Aftershocks headphones. They actually sit in front of your ear, so they're wireless, but they work by bone conduction. And it's great because you can still, if you start singing, you stay on key a little bit better because you can still hear yourself. So yeah, if you see me running out in the neighborhood and I'm singing to myself, that's why.
That's actually really cool because I'm a singer myself, so I know from like in-ear monitors from that standpoint, you do get some bone conduction feedback through those as well. So I actually did not know that was a thing you could get outside of those. So that's really cool.
They're amazing, and they're much safer for running or being outside because you can, it leaves your ear open and just sits right in front of your ear. So they're really great.
Yeah. So while everyone's still doing some social distancing and trying to stay active and be proactive about their health and migraine symptoms, then you can listen to music safely while you run still.
Absolutely. Or, you're trying to keep your ears a little open so you can hear your kids homeschooling and, yet you want to listen to a podcast.
Yes. Dual tasking, right?
Yes.
Well, Laurel, that's kind of all the questions we had prepared for you today. We truly appreciate your time and just your unique perspective and background and level of education echoing in on these areas. So were there any other questions or anything you were curious about or wanted to conclude with?
I don't think so. I would just put a plug out for, I do have a website if anybody is interested on self-management techniques for migraine. It basically has some short animated videos and then some links to resources for health behaviors, and it's yourmigrainetoolkit.com. It's totally open access website. That's what I did for my doctoral work. And yeah, I really appreciate the interview and being able to share some information about how we treat migraine patients.
Awesome. Yes. So I've actually directed a few patients to that website. For everyone watching, it's a really, really good toolkit, again, to just empower yourself to learn more about your own symptoms and proactive ways to start moving forward in a better direction for you to get your life back, get your health into your own hands. So yeah, thank you, Laurel, so much for this time. We truly appreciate it. And we look forward to learning from you again, hopefully sometime in the future, and just talking with you again soon.
Great. Anytime. Have a great day, Nate.
Thanks. You too, Laurel.
Okay. Bye.